Vaginal discharge is a normal and healthy part of the female reproductive system. It is produced by the glands inside the vagina and cervix and serves to clean and protect the vagina by carrying away dead cells and bacteria. The amount, color, and consistency of vaginal discharge can change throughout a woman's menstrual cycle, and can also vary based on other factors like age, hormonal changes, and overall health. Normal vaginal discharge varies from person to person but generally has these characteristics. Clear or milky, the discharge may be clear or white and is often odorless or mildly scented. Consistency, it can vary in consistency, ranging from thin and watery to thicker and mucus-like. Amount, the amount can increase or decrease depending on the stage of the menstrual cycle. For instance, during ovulation, discharge may become more abundant and stretchy, resembling egg whites. Odor, it generally has a mild, non-offensive odor. The strong or foul smell may indicate an infection. Factors that affect vaginal discharge: menstrual cycle. Before ovulation, discharge may be thick and sticky. During ovulation, discharge becomes clear, slippery, and stretchy, similar to egg whites, which helps sperm move through the cervix. After ovulation, discharge may be thicker and more opaque. Pregnancy. Vaginal discharge can increase during pregnancy due to hormonal changes. It is typically clear or white and may have a slight odor. Sexual arousal. During sexual arousal, vaginal discharge may increase in volume and become more slippery to facilitate intercourse. Hormonal changes. Hormonal shifts due to puberty, menopause, birth control pills, or hormone replacement therapy can affect the consistency, amount, and appearance of discharge. Medications. Certain medications, like antibiotics, can change the balance of bacteria in the vagina, leading to changes in discharge. Abnormal vaginal discharge. Changes in vaginal discharge can sometimes be a sign of an underlying health issue, including infections or other conditions. Abnormal discharge may involve color changes. Yellow or green may indicate a bacterial or sexually transmitted infection, STIs such as gonorrhea or trichomoniasis. Grayish, often associated with bacterial vaginosis, which is caused by an imbalance of bacteria in the vagina. Brown, could be a sign of old blood, which may appear after menstruation or could indicate an issue with the reproductive organs. Pink or red, could be a sign of bleeding, either from the vagina itself or from the cervix, which can occur during or after sex, or could indicate a more serious condition, such as cervical or endometrial cancer. Odor changes. Strong, foul odor. This may indicate an infection, such as bacterial vaginosis, trichomoniasis, or a yeast infection. The fishy smell is a hallmark sign of bacterial vaginosis. Increased amount. If there is a noticeable increase in the amount of discharge, it could be a sign of an infection or other conditions like cervicitis, STIs, or endometriosis. Other symptoms: itching, burning, or irritation. These are common signs of infection, especially in conditions like yeast infections or STIs. Painful urination or intercourse. These symptoms may point to a urinary tract infection, UTI and STI, or other reproductive tract issues. Swelling or redness. This may indicate an infection or inflammation in the vagina or surrounding tissues. Common causes of abnormal vaginal discharge: bacterial vaginosis (BV). This is the most common vaginal infection in women of reproductive age, caused by an imbalance of naturally occurring bacteria in the vagina. It often leads to a thin, grayish-white discharge with a fishy odor. Yeast infection. Candidiasis, or a yeast infection, can cause thick, white, cottage cheese-like discharge, along with itching and irritation. It is often caused by an overgrowth of the fungus Candida. Sexually transmitted infections, STIs, chlamydia, gonorrhea, and trichomoniasis can cause unusual discharge. These infections may produce a yellow, green, or frothy discharge with or without odor, and often have associated symptoms like pelvic pain, itching, or pain during sex. Vaginal atrophy, atrophic vaginitis. This condition occurs when the vaginal walls become thinner, drier, and less elastic, often due to a drop in estrogen levels such as after menopause. It may cause an increase in discharge, which could be clear, watery, or slightly yellow. Cervicitis. Inflammation of the cervix caused by infection, e.g., an STI or other infections. The discharge may be thick, yellow, or green. Pelvic inflammatory disease, PID. PID is an infection of the reproductive organs, often caused by untreated STIs, that can lead to abnormal vaginal discharge, pelvic pain, and fever. Foreign bodies. The presence of a tampon that has been forgotten or left in the vagina for a prolonged period of time can cause an infection, leading to foul-smelling discharge. When to see a doctor. While some variations in vaginal discharge are completely normal, it's important to consult a healthcare provider if you experience any of the following. Discharge that has a strong, unusual, or foul odor. Change in the color of discharge, especially if it is yellow, green, or gray. Itching, burning, pain, or swelling in the vaginal area. Painful urination or pain during sex. Blood in the discharge outside of your regular menstrual period or after intercourse. A noticeable increase in the amount of discharge. Diagnosis. Healthcare provider will often conduct a pelvic exam and may take a sample of the vaginal discharge to examine it under a microscope or send it to a lab for testing. If an infection or other medical condition is suspected, further testing, such as STI testing or cultures, may be done to identify the cause of abnormal discharge. Treatment options. Treatment for abnormal vaginal discharge will depend on the underlying cause. Antibiotics. For bacterial infections like bacterial vaginosis or STIs, antibiotics oral or topical are commonly prescribed. Antifungal medications. For yeast infections, antifungal treatments either oral or topical are effective. Antivirals. If the discharge is related to a viral infection, like herpes, antiviral medications may be prescribed. Hormonal treatment. For conditions related to hormonal changes, such as vaginal atrophy or menopause-related dryness, estrogen creams or other hormone-based treatments may be recommended. Improved hygiene. Practicing good hygiene, avoiding scented products, and wearing breathable cotton underwear can help maintain healthy vaginal flora and reduce irritation. Prevention. Practice safe sex. Use condoms to reduce the risk of STIs that can cause abnormal discharge. Maintain good vaginal hygiene. Clean the genital areas gently with water, avoiding harsh soaps, douches, or scented products that can disrupt the natural balance of bacteria. Manage stress. High stress levels can affect hormonal balance, which may impact vaginal health. Maintain a healthy diet. A balanced diet rich in nutrients can help maintain overall health and support the immune system, which may help prevent infections that lead to abnormal discharge. Stay hydrated. Drinking plenty of water can support general health and help prevent infections. Conclusion. Vaginal discharge is a normal bodily function, and its appearance can vary depending on several factors like hormonal changes, menstrual cycle, pregnancy, and sexual activity. However, significant changes in the color, odor, or amount of discharge, especially if accompanied by pain or other symptoms, may indicate an infection or other health issue. If you experience these changes, it's important to seek medical advice to ensure appropriate diagnosis and treatment.